Hello, this is Jenny Slagle with Better Health Together. Thank you for joining us for the Community-Based Care Coordination and the Pathways Hub Model webinar. We apologize for the technical difficulties that we had with the last webinar, so we thought we would try to re-record it today. My role here at Better Health Together includes leading the work with the Community-Based Care Coordination, tribal liaison work, and also the navigators work here at Better Health Together. I'll be going through some of the efforts that we have going on around community-based care coordination and specifically go over some of the key elements of the Pathways Hub model. If you have any questions after the webinar, feel free to always contact me or any of the staff. I'll have the contact information at the end of the webinar. So when people ask why we need community-based care coordination, which can take on many different types, we like to refer back to the facts that more than half of patients can't state their diagnosis when leaving the hospital, and more than a third can't explain their medications. Educating patients about why they're in the hospital, including their diagnosis and emergency warning signs, can help patients understand what to expect after leaving the hospital and symptoms that are an emergency. The Pathways Hub model is really focused around risk and reducing risk. Better health outcomes are achieved only if the social determinants of health are addressed and overall risk is reduced. We developed a very powerful risk scoring framework allowing for unlimited scores to be developed and processed. I should state rather, the Hub model has developed this risk scoring framework. The scores are comprised of different risk factors from social health, behavioral health, personal health management, financial, and clinical factors. Each one is built from any combination of client and pathways data within the system. The system then processes the information and provides the care team with effective pathways risk queue information, thereby allowing the care coordinator or the community health worker to develop with the client a path a health plan that is appropriate for them. The foundation of the model is pretty simple in that we try to identify and find at-risk people and totally assess their risks and protective factors, tracking all identified risks within the Pathways platform, measuring the results. For example, an at-risk family might have 2, 5, or more care coordinators working with issues. Better Health Together has developed 3 short videos explaining the Pathways model from each perspective of the hub, the coordinator, and the client. These videos can be found on the Better Health Together website. This is a general listing of the 20 pathways and what is deemed a successful outcome of each of them. This is a standard checklist that is used to collect data. Data is collected only after a release of information during an intake or an initial checklist enrollment is conducted with the care coordinating CHW or care coordinator. There's an ongoing checklist every month or bi-weekly appointment that the clients have with the CHWs during a face-to-face visit. Pathways allows comparisons on multiple levels, allowing us to get to a comprehensive picture of an agency, community, and the region. The role of the hub is really coordinating the coordinators, as we like to refer to it. We are responsible for helping our partners develop and streamline the referral process, eliminating duplication of services, providing the common data collection tool for the care coordinating agencies, which is all of the various checklists within the Pathways model, the tools such as the care coordination system technology. We develop contracts with payers. We develop contracts and enter into contracts with the care coordinating agencies who will be delivering the direct care coordination services. And then we work with referral partners, aligning the referral process, and then work with the care coordinating agency on a regular basis. Most communities have a lot of resources, but we find it's fragmented. During the summer of 2017, BHT surveyed regional organizations through a care coordination inventory to learn more about the organization's client and gather provider interest, capacity, priorities, and existing efforts relating to Medicaid transformation care coordination projects. Of the responses that we received back, 29 agencies were identified, and Better Health Together will continue to use the information gathered to coordinate and leverage existing care coordination to ensure that the hub does not duplicate or compete with any existing efforts. These are some key points of the hub and the operation. The hub does not employ nor conduct direct care coordination services. There typically is only one hub in any given community or region, and Better Health Together is fulfilling that role within our region. We envision that the Hub Council will transition to the Community Advisory Board role once and if the hub seeks certification. Distinctions between the Pathways, the model, and the community hub are just as outlined here. Pathways, the model, is a tool that is utilized by care coordinators or community health workers, which measures outcomes, and thereby the hub uses the data to measure various outcomes. The care coordination agency role is that they are contracted with the hub and they provide the direct community-based care coordination services. They commit to having at least a full-time community health worker or care coordinator and some type of supervisory role. Requirements of being a care coordinator in the Better Health Together hub is at least 230 hours, 5 days care coordination specific to the model, and 5 days Pathways and care coordination systems platform training, along with a 2 to 4 week practicum. And then the hub, excuse me, meets with the care coordinating agencies on a regular basis. These are just examples of the different tools that are utilized within the care coordination systems. Checklists are conducted on a regular basis. The tool itself is the Pathways Hub Connect care coordination systems. It's the foundation and key to the hub organization and organized care coordination. For a coordinator, the portal is used to review caseloads, set appointments, and provide client encounters. It records pathways and checklists, reviews client, and they're able to review client information and client history and report on it. The supervisor would also be able to review the caseload and accomplishments of each individual care coordinator, review appointments, communicate tasks, reports, and etc. And also would authorize signature to the completed checklists and work. For the hub staff, we use this system which helps us create invoices for completed pathways, outcomes, and monitor. Each pathways risk queue data point is available for charting, research, and analysis. This helps us find, treat, and measure the highest at risk and be able to see that. The pathways risk queue drives the efforts to reduce risk in communities, improve population health, and lower healthcare costs. This is a graphical representation of plotting the different risk queue scores that the system is able to do. Care Coordination Systems is developing a Pathways mobile device, and the Better Health Together region is slated to be a beta tester. We envision that the mobile will be used in the field by care coordinators, and they'll have full access to their caseload files and the different pathways. Best of all, they'll be connected and synchronized with the care teams through the hub. The care coordination payroll of the managed care organizations, city governments, and county governments who contracts with the hub. Establishes contracts based on population covered and pathways and tools that are compensated, and this is utilized through a outcome-based unit type of strategy. Currently, A Better Health Together has been running a Ferry County pilot in Ferry County. The Ferry County Jail pilot was funded by the State Innovation Model and launched early 2017. Lessons learned from the pilot help us address any issues as we look to expand the Pathways Hub and scale it in the region. In total, 29 clients were referred to the hub and 21 were enrolled. While the number of successful outcomes, RVUs, relative value units, aren't substantial for data purposes, social services were the most utilized referrals in the hub, with medical home, medical referrals, and health insurance most frequently used. The goal of the pilot is to reduce overall recidivism, reduce the cost of jail health services provided within the jail, and divert emergency department utilization. Our goal, as stated here, is to serve at least 60 clients in 2018. Currently, we have one care coordinating agency, which is Rural Resources. We are lucky and glad to be partnering with them as they provide many of the social services within that county. Looking ahead here in 2018, we've been working with the Spokane County planning team to BHT will be contracting with the Spokane County to implement a jail transition pilot here in Spokane County. This is funded via a Department of Justice grant that's just under $1 million and is one of the strategies that the county is using for reentry. While the target population is still being worked through, we anticipate and hope that It would serve males between the ages of 18 to 35 with an identified behavioral health need, and hope that preference or some type of will be include the clients from communities of color. Our goal for the grant as a whole through the course of the grant is to contract 2 care coordinating agencies who will serve at least 200 clients through the course of the grant. And BHT's goal for 2019 is to serve 200 clients in Spokane County. The hub and the collaborative planning have been happening kind of hand in hand, and working with the collaboratives, they've all decided to utilize, all 6 counties have decided to utilize the Pathways model for care coordination activities in each of their counties. The board of directors have allocated funds which will support proof of concept in each of the county collaboratives. The funds will support initial startup costs such as technology, licensing, training, staffing, and help subsidize at least a 3-month startup stipend as outcomes are able to be achieved. We're working with MCOs to figure out a share cost for outcomes through the next coming years, and we anticipate that the first year they will pay for 25% of the outcome payments. Rural collaboratives will receive a monthly stipend and possibly a lower outcome payment to help offset the small population that Spokane County versus the Spokane County. The Hub Council is made up of all types of providers, including primary care, behavioral health, social service, public health, and county governments. Council is co-chaired by Fawn Schott and Greg Knight. The key goal of the council is to align infrastructure, which includes data, coordinate community resources, and launch efforts to better weave care coordination funding. Additionally, the Hub Council will also work to align community-based care coordination activities of their other models. One example is the Spokane Fire Department CARES care coordination activity going on. They're a volunteer team of EWU, MSW students who provide care coordination and serves mainly Medicare clients, but in discussions with them, they're looking for a structured care coordination model and case management technology that they could use. Our hope is that we could include them in some of our care coordination activities. MCO and other IT considerations. We are wanting to make sure that the Pathways model is complementing existing care coordination efforts such as health homes. Wherever possible, we want to make sure that we're aligning processes and resources. We are working across the state to do that, and also working with other ACHs and the Department of Health for possibly a shared service agreement of the care coordination systems platform and training resources. Another aspect is statewide alignment of Pathways evaluation. As stated, the approved funding is really designed to help a proof of concept. We want to prove the concept by staying true to the model that is based on care coordinating agencies finding at risk and successfully achieving Pathways outcomes. Through the collaborative work, each of the counties, as I said, selected target populations of either those transitioning out of jail or high-risk pregnant mothers. Waiver money will help pay for technology, consulting, and capacity payments for these pilots to get started. Here is a general outline of the evaluation process. Once it'll be ongoing, and after the pilot ends, that the Pathways model will be evaluated. We're working across the state for a cross ACH shared project to evaluate the Pathways approach. Through an RFP process, BHT has selected Providence Core for the first year evaluation. Core will utilize the evaluation elements and activities listed here as an example. This will help align evaluation across the region and the state. Again, we thank you for joining our Pathways webinar and apologize for previous technical difficulties, but feel free to contact us if you have any questions or any concerns. If you'd like any further information about the Pathways model, we'd be happy to provide further